Hello, everyone. Welcome to part 1 of 2 of the education program on food insecurity. Our team has created a survey to determine how this presentation influences how participants view household food insecurity and possible solutions. This survey is not an assessment of staff capacity in any way, and it will only be used to help improve this program. Your participation in this survey is completely voluntary. Whether or not you participate or your answers to the questions will have any impact on your position with HPPH. If you are willing to participate in this survey, please follow the link in the description below. The link can also be found on this slide. Although there are no direct benefits in participating, we really appreciate your feedback to improve our food insecurity resources. Also, your responses are completely anonymous and confidential. Responses will only be reported in groups, and individual responses will not be shared. Only the share team at HPPH will have access to the survey results, and they will be securely stored at HPPH for 5 years, and then they will be deleted. If you have any questions about the survey, please contact Chisomo, our program evaluator. You may pause the video now to complete the survey and press play again to resume when you're ready. This program aims to raise awareness about what food security is, its prevalence, and effective ways it can be addressed. My name is Candace Cunningham, and I am a registered dietitian here at HPPH. I want to thank every one of you for participating in this program and being willing to learn more about such an important topic. I acknowledge that all of you have the knowledge of and perhaps experience working with individuals living with food insecurity. I hope to learn as much from you as I hope you can learn from this presentation. If you have any questions throughout the presentation, please write them down. Once the presentation is over, we can set aside time to have a discussion with you and your team about our experiences working with food insecurity and how we can learn from one another. Module 1 in this program provides an overview of what food security is, its prevalence, and who is at an increased risk. First, it is important to note the difference between hunger and food insecurity. Sometimes people will use the phrase like hungry people to describe individuals living with food insecurity. However, hunger and food insecurity are not the same thing. Hunger is a physical response to a lack of food, and not everyone who is food insecure experiences hunger. Food insecurity is more complex, and whether with or without hunger, it has negative impacts on individuals experiencing it. Although the phrase hungry people creates an emotional response, it takes away from what food insecurity actually is. To be food secure, the following criteria must be met. The first criteria is availability. Which food is available to you to purchase at a store or market when you need it? Accessibility refers to both physical and economic access to food. Physical accessibility means you are able to walk, drive, or ride a bus to a store or market in your community, whereas economic accessibility means you have the money to purchase the foods once you get there. Adequacy means that the food you have to access is both nutritious and safe and produced in environmentally sustainable ways. Acceptability, which is less known, refers to the access of culturally acceptable foods, which is produced and obtained in ways that do not compromise people's dignity, self-respect, or human rights. And finally, agency refers to the policies and processes that enable the achievement of food security, such as community knowledge of the food system and policies which protect it. This criteria for food security encompasses the whole food system. Household food insecurity, which is the focus of today's presentation, is the inability for individuals and families to afford food. The definition of household food insecurity by Statistics Canada is the inability to acquire an adequate diet or quantity of food in socially acceptable ways, or the uncertainty that you will be able to do so, or simply inadequate or insecure access to food because of financial constraints. Please note that for these sessions, the terms food insecurity and household food insecurity are used interchangeably, but we are discussing food insecurity at the household and individual level. There are three categories of household food insecurity: marginal, moderate, and severe. Marginal means the household struggles with worry regarding providing food for their family, or they have had some sort of income barrier keeping them from getting the food they need. When a household is moderately food insecure, they are unable to afford healthy food and may limit how much they eat in order to spread out the food for a week or a month. Severely food insecure households often experience hunger and miss meals because they cannot afford to feed their families. Although these categories vary in magnitude, they all have the same thing in common: inadequate funds to afford food. Now that we know what food security is, how prevalent is it in Canada? How many households are experiencing food insecurity? Considering Canada is a wealthy country, many would assume the percent of food insecure households would be low. However, the 2020 Canadian Income Survey found that just under 16% of all Canadian households experience food insecurity. 1 in 5 children lived in food insecure households, and in total, Ontario had over 2.3 million people who are living with food insecurity. I do want you to keep in mind that the Canadian Income Survey does not include the territories, those living on a reserve or other Indigenous settlements, those living in institutions, and those living in extremely remote areas with a very low population density. So this estimate is likely lower than the actual percentage of food insecure Canadians. This survey is also collected between January and September 2021, despite it being called 2020. In comparison to other countries, the United Nations, which use a different survey tool, found that Canada had a higher food insecurity rate than European countries, such as Germany, France, and Sweden, and only a slightly lower rate than the United States. The prevalence of food insecurity is particularly higher in certain groups. In 2021, technically speaking, household respondents who identified as Black or Indigenous had the highest rates of food insecurity. 22.4% of all households who identified as Black and 30.7% of households who identified as Indigenous were food insecure, compared to only 13.2% of individuals who identified as white. This increased prevalence exists even when sociodemographic and economic characteristics are adjusted for, because of this systemic disadvantages they continue to experience. Specifically, lack of access to traditional food and land rights creates unique barriers for Indigenous communities. Lower educational attainment, which is a social determinant of health, often related to household income, is also associated with a higher prevalence of food insecurity. This is the same for households that rent their living space opposed to own. and individuals who are on social assistance or employment. About 63% of individuals on social assistance experience food insecurity. However, food insecurity is not solely in this population. In fact, 52% of all food insecure households in Canada are in the workforce and obtain their funds through salaries or wages. So, although households who rely on social assistance are more likely to be food insecure, they only make up 9.4% of all food insecure households. This data shows that working families, because of low wages, part-time, or precarious work, cannot afford to feed their families and purchase basic life necessities. Food insecurity is prevalent in both urban and rural communities. Although we do not have a great rate of household food insecurity in Huron and Perth County, we do know that in 2021, there was more than 2,200 visits to Huron food banks alone. This is a definite underestimation of food insecurity, as only about 25% of food insecure individuals typically use a food bank. Although there is high sampling variability, using the CCHS 2017 data, it was found that 11% of households in Huron and Perth counties were moderately or severely food insecure. In 2021, it was reported that over 1,400 individuals in Huron and Perth County live on low income and cannot afford a standard healthy life, such as safe and healthy food. So now that we know a little bit more about what food insecurity is, I want to talk about what food insecurity isn't. First, food insecurity is not a food accessibility problem. Food accessibility means healthy and safe food are available in your community, either through a grocery store or food outlet. Insecurity and inaccessibility can coexist in the same neighborhood, but they are two different things. Increasing the accessibility of food in the community does not mean that they will be able to afford it. For example, a program in Saskatchewan implemented a grocery store called the Good Food Junction in a low-income neighborhood in hopes of improving access and decreasing food insecurity. Unfortunately, only after 1 year, it was shut down. Although the foods were heavily discounted, the communities could not afford to buy enough food to keep the store open. So although their accessibility to food increased, it did not decrease their food insecurity. At a local level, Huron and Perth counties are both agricultural hubs with a variety of farmers markets and community gardens. And these factors increase food accessibility. Food insecurity still exists in both counties. Inadequate income is the missing piece to this equation. The Nutritious Food Basket is a survey tool used by health units to measure the cost of healthy eating in their community. It consistently shows that social assistance rates are not enough to pay for rent, daily expenses, and a basic healthy diet, in particular because social assistance has not kept up with food inflation rates. The Nutritious Food Basket estimated in 2022 that a family of 4 in Huron and Perth counties would need to spend a minimum of $1,076 a month to purchase a very basic healthy diet. Whether this is too much depends on the family's income. Canadians actually spend less of their income on food than any other developed country. So if the price of food is relatively low, why have food insecurity rates continued to increase. The reason is that someone making the average salary in Canada only uses about 9% of their income to pay for food. But when your income is significantly lower than the average, your percent of income to pay for food will be significantly higher. The lower your income, the more unlikely you are able to afford food. Even when healthier foods are available at a cheaper price, only the diet quality of middle but not low-income households improved. The low-income households can still not afford the food they need to improve their diet. The issue is not accessibility or the price of food. The issue is that the families do not have enough money to purchase the food they need. A common misconception about food insecurity is that it is caused by a lack of budgeting skills. However, the majority of food insecure households reported using a budget when purchasing food, in comparison to only about 43% of adults in food secure households. You can't budget yourself out of an inadequate income. Households struggling with food insecurity do not need to be taught how to budget because they're already doing it and they're still food insecure. Another common misconception is that food insecurity is caused by a lack of food skills. However, when we look at the national data, there's no difference between the self-reported food skills of food insecure versus insecure households. A qualitative study in rural Southern Ontario households found participants were food insecure despite having extensive food skills. They reported growing and canning foods, even hunting and fishing. Yet, despite this, participants still struggled to feed their families. One participant stated, "I'm behind on everything. I'm officially 1 month behind on my mortgage payment, 2 months behind on my hydro payment, a month behind on my phone bill," and the list continued. So whether or not we look at the individual stories or national data, food insecurity is not a food accessibility, food cost, budgeting, or food literacy issue. Food insecurity is caused by inadequate income. Now that we know what food insecurity isn't and what really causes it, Module 3 will focus on the public health consequences of food insecurity and how it affects health. People living with household food insecurity often can't buy enough healthy food to meet nutrition recommendations. So they are likely to have lower nutritional status. They also have a higher probability of having various chronic illnesses, such as diabetes and hypertension, which is likely related to the daily stress and inability to afford basic needs that food insecure households experience. Food insecurity also makes it more difficult to manage diagnosed chronic diseases. For example, the cost of affording medication for diabetes or hypertension. They also have a greater risk for poor dental health. The most severe risk of food insecurity is the mortality rate. Research shows that severely food insecure individuals die an average of 9 years earlier than someone who is food secure. This is related to the increased risk of disease, chronic illness, injuries, and suicide. It's hard to hear and see this number, but it shows the extreme impact food insecurity has on someone's life. Those living with food insecurity are at a higher risk of adverse mental health conditions. For example, those living in food insecure households are 5 times as likely to report having anxiety, 2 times as likely to have depressive thoughts, and 2 times as likely to report having suicidal thoughts in comparison to households that are food secure. Even those with only moderate food insecurity still have a twofold increase in poor mental health outcomes compared to food secure households. Parents who attempt to shield their children from the adverse outcomes of food insecurity by choosing to skip meals themselves and letting their children eat instead. As one mother said in Ontario, if it's the choice between food for kids and food for mom, kids come first, mom doesn't. I just don't eat, or I don't eat as much as I need, and I'm still hungry. However, despite their best efforts, children are still affected by food insecurity. Children with poor dietary intake from food insecure households are less likely to meet the expectations for reading and math. And children who experience hunger from food insecurity are more likely to have poor physical health and an increased risk of depression and even suicidal thoughts in adolescence. These significant health outcomes for both children and adults show the urgency of this public health issue. The cost of food insecurity is also an economic concern. Because of the increased risk of poor health, those living with food insecurity typically visit the hospital more often and need more medical attention, which results in higher healthcare costs. When compared to those who are food insecure, marginally food insecure households have 16% higher annual healthcare costs. Moderately insecure are 32% higher, and severely food insecure households have 76% higher healthcare costs. This adds up to an additional $1,000 per year for severely food insecure households. Considering over 3% of households in Ontario are severely food insecure, this costs Ontario an additional $150 million a year for healthcare costs when households are severely food insecure. This shows that the cost for people to not afford food has a significant effect on health and medical needs of Canadians and our economy. To summarize what we've learned in today's modules, Module 1 showed us that food insecurity is prevalent in our country and community, and that it is caused by inadequate income. Module 2 explained that food insecurity is not a food availability, budgeting, or food skill issue. Module 3 gave us insight into the public health consequences food insecurity can have on families' physical and mental health and our healthcare costs. And that brings us to the end of part 1 of 2 for the program. Please continue to part 2 to learn about what we can do to address food insecurity. Also, the health equity team understands that food insecurity can be a difficult topic to discuss. So if you are having any negative or difficult feelings after this presentation or evaluation, anyone from the health equity team are available to support you for a debrief session. I have included Donna Parson, the health equity lead, and Gloria Workman, a community developer, contact information on this slide.